We now continue with our series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We now enter post-op week 8 of Maddie's rehab progression, and our goals are to maintain her motion, continue to build a strength base, progress balance, and progress her functional activities over the next 2 weeks as we prepare her to begin a walk-jog progression. We added things such as front squats. We continue with leg press, going to a single leg versus a double leg, doing some box steps with TheraBand resistance to bring in the abductors, lunges with a Viper cord, and we added a Romanian deadlift, single leg bridges, and some fun activities like the tire pull. A video summary of all these exercises is now shown. Now, for those of you that aren't familiar with the front squat, which is shown here, it's a variation of the traditional squat where the bar is held in the front, and in doing this they have to keep an upright position so they don't drop the bar by bending forward too far, something they can do if they're doing a traditional back squat. You can see here she has good form. She's going down to about 60 degrees, but she does need to keep her elbows up a little higher. With the lunges, she's got resistance posteriorly, so she has resistance going forward, and it actually helps pull her up after the step is done. I have her do it in alternating from side to side so we can work on controlling the body and keeping everything in good position. If anything, her front knee tends to come forward a little bit more than we would like. The box step shown here just has TheraBand around the ankles to bring in the abductors as they step. It also provides some resistance that brings in a little bit more balance and control as they're going. Obviously, controlling the height of the box can make the exercise more difficult. Back extensions are done with medicine ball for resistance. And here we did some bridging exercises to work on the glutes and hamstrings with the feet on a foam roll, working on both single leg and double leg. The hands are pointed towards the ceiling so she can't push down with her elbows and take away the trunk stabilization aspect of this exercise. Now, the modified deadlift that's shown here is a new exercise that we added to Maddie's routine. It starts to bring in balance, control, and strength as she goes through the motion. And you can see here on the right she went into a nice T position, but when she's balancing on her left she isn't able to maintain this same form, not only because of decreased balance reactions on the left, but also because of lack of muscle control. And at this point in the session, she's actually starting to fatigue as well. Now, after she finishes this repetition, we're going to look at her again from behind. And you can see in this position that as she's going down, she's having problems maintaining her trunk position and her spine angle, and she's having problems bringing her right leg up into extension to help to counteract her with the balance. This is something we'll continue to work on as she goes through this, but it was her first time doing the exercise. The tire pull can't be done everywhere, but it's a great exercise to work on hamstring and glutes, and you see she can't really pull back with her left leg as much. We've done single leg on the shuttle before. We did it here with a ball under the foot to bring in a little bit of balance and proprioception as well as knee control. All of these are great variations of exercise. I also want to project some trunk activities. We added some TheraBand resistance to bring in some core progression and also some med ball balance hip extension activities with a broom handle on her back so that she has to maintain a good spine alignment and not let her hips drop or it would fall off. Here she's doing a Bosu squat, holding onto a medicine ball, and then I'm adding some resistance to the medicine ball to shift her center of gravity to make her work. Last but not least, we want to progress her functional activities on the ladder, going through the motions but increasing the speed as she is comfortable doing this. And we still want to continue to stretch the hip flexors, which are tight, treat with modalities, and let her catch up with her texting at the end of the session. Any questions, please post them on the forum.